We know that capnography, the monitoring of end-tidal CO2, is important to the well-being of hospitalized patients. But just how important can it be? Amanda Abil, a beautiful, bright, and vibrant 18-year-old young woman, was hospitalized one day almost 2 years ago with a severe sore and swollen throat. The doctors admitted her to the hospital to rehydrate, administer antibiotics, and manage her throat pain. She was placed on a PCA device that allowed her to control the amount of the painkiller she would receive. Amanda's family and friends hoped she would be going home soon. Instead, about 12 and a half hours after receiving the pain medication Dilaudid through the PCA pump, Amanda was found unresponsive. Amanda's cause of death is still not clearly known, but we do know this: there was no monitoring of Amanda's end-tidal CO2. Would an alarm signaling Amanda's dropping EtCO2 level have alerted caregivers to check on Amanda's condition in time to save her? Amanda's parents and friends know they can't do anything about Amanda's death, but they want to prevent a situation like Amanda's from ever happening again. They've started a foundation called A Promise to Amanda. Their goal is to keep the story of Amanda alive and help build awareness about the importance of capnography monitoring for all patients on PCA pumps and to anyone hospitalized who may be at risk of respiratory depression. The Abils have told Amanda's story to local media and to people in their community. Through the foundation, they are contacting companies and organizations like Oridion and the Physician-Patient Alliance for Health and Safety to help bring their outreach efforts to a national level. A good friend of the Abil family introduced them to a graphics design professor at Notre Dame. When the professor heard the story of Amanda's tragedy, he immediately suggested that as a semester project on designing for positive social change, his students design a website for the foundation. The website project was initiated with a presentation to the class by representatives from Oridion, Care Fusion, the Physician-Patient Alliance for Health and Safety, and nurses from St. Francis Hospital in Beech Grove, Indiana. Correspondents from local media were invited to attend, and the press generated was tremendous. As a result, a broad network of support for the foundation unfolded. The emails poured in. Hospitals in New York and Boston and along the South Coast. A doctor at Johns Hopkins University involved in a patient safety and quality initiative. And even health experts responding to express grief and willingness to help. The foundation outreach continues to blossom and gain momentum. So tragedies like Amanda's won't happen again.